By the end of this module, you will identify major categories of common mental health disorders, describe symptoms, causes, and warning signs of each condition, understand condition-specific risks and complications, know when and how to provide mental health first aid, recognize when to seek urgent professional intervention. This module is designed to equip you with a thorough understanding of the most common mental health conditions, their signs and symptoms, risk factors, and possible consequences if left untreated. The goal is to empower you to recognize early warning signs in yourself and in others, and also provide supportive first-line responses. Introduction to mental disorders. Mental disorders are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. They are associated with distress and/or problems functioning in social, work, or family activities. Most mental disorders have biopsychosocial origins, including genetic predisposition, environmental stressors, traumatic experiences, chemical imbalances, substance use, social isolation, chronic illness. Common mental health conditions explored. A. Depression. A mood disorder marked by persistent sadness, lack of interest in activities, and feelings of hopelessness. Physical symptoms may include fatigue, weight changes, sleep disturbance, may lead to suicidal thoughts or behaviors if untreated. Affects over 300 million people globally. WHO. Key signs: withdrawal from activities or people, negative self-talk or low self-worth, difficulty concentrating, changes in appetite or sleep patterns. B. Anxiety disorders. Includes generalized anxiety disorder, GAD, panic disorder, phobias, social anxiety, characterized by excessive fear or worry, often disproportionate to the situation. Key signs: restlessness, irritability, sweating, palpitations, avoidance behavior, intrusive thoughts or compulsions. C. Bipolar disorder, a mood disorder involving alternating episodes of depression and mania or hypomania. Manic phases include heightened energy, impulsivity, reduced need for sleep. Can disrupt work, finances, and relationships. D. Schizophrenia and psychotic disorders. Schizophrenia affects perception and behavior. Common symptoms: hallucinations, delusions, disorganized thinking. It is not the same as multiple personality disorder, a common misconception. E. Eating disorders. Includes anorexia nervosa, bulimia nervosa, binge eating disorder, often rooted in body image distortions and psychological distress. F. Post-traumatic stress disorder, PTSD, triggered by exposure to traumatic events. Symptoms include flashbacks, nightmares, hypervigilance, and emotional numbing. Common in survivors of violence, war, abuse, or disasters. General obsessive-compulsive disorder, OCD, characterized by intrusive, unwanted thoughts, obsessions, and compulsive behaviors performed to reduce anxiety. H. Substance use and addiction. Includes both legal, alcohol, prescription drugs, and illegal substances. Often co-occurs with other mental illnesses, dual diagnosis. Addiction is not a moral failure but a complex brain disorder. Mental health in different populations. Children and adolescents. Increasing rates of anxiety, depression, and self-harm, influenced by bullying, academic pressure, social media. Older adults. High risk of depression, dementia, and loneliness-related anxiety. Often underdiagnosed or misunderstood as normal aging. Workplace settings. Stress, burnout, and harassment can lead to anxiety and depression. 1 in 6 workers experience a mental health problem at any given time. UK stats. Early warning signs to look for: persistent low mood or irritability, withdrawal from social interaction, drastic changes in behavior, sleep, or appetite, neglecting personal hygiene, talking about feeling empty or having no purpose, mentioning death or self-harm, red flags for immediate help, suicidal ideation or plans, self-harming behavior, psychotic symptoms, delusions, hallucinations, aggression or violence due to mental disorientation, complete withdrawal from reality. In these cases, you are trained to remain calm, ensure safety, and refer immediately to professionals. Empathetic first aid responses. Use non-judgmental listening. Stay calm and composed. Avoid saying, "snap out of it," or "be strong." Encourage professional help. Respect confidentiality.